older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
Hello, and welcome to another segment of Amazing Grace. I'm so excited to have with me Dr. Bannister and his lovely wife, Dr. Stephanie Coursen. Welcome, both of you.
Thank you.
It's so nice for both of you to be here.
Nice to be here. Thank you, Joe.
We're here to talk about something that the average person gets. I'm not even sure anymore that it's a senior problem. It appears to be a problem, period, and that's arthritis. Mr. Arthur. Can someone tell me what is arthritis?
Sure. Arthritis is extra bone formation in places it shouldn't be. They're little lips and spurs that grow on the bones, particularly joints, not only in the spine, but in the skeletal system too.
Now, as far as arthritis, can you have it anywhere? I mean, is there such a thing as foot arthritis? Or?
There definitely is, all over the body.
So the whole body could have company with Mr. Arth?
Definitely, yes.
Okay, what are the different types of arthritis?
You want to take that one?
Well, we have osteoarthritic degenerative change, and what that is generally an area of, we'll take the spine for example, because obviously the spine is extremely important to our health. If an area of the spine is injured, that area of the spine which is injured tends to develop more osteoarthritis. You'll get extra bone formation, and the discs, the little pads between the bones, they start to get thin. Then you've got rheumatoid arthritis, which is more of a, one way you can tell, by the way, if it's uniform on both sides, that's a sign that it could be rheumatism or rheumatoid arthritis. But chiropractic is extremely important to your health. Specifically in regards to arthritis, you want to keep the spine mobilized, you want to keep it aligned. Everyone thinks a chiropractor takes a bone and puts it back into alignment. Well, that's true, but it's very important to mobilize the spine. It's very important to keep these segments flexible. And someone might think, oh, I exercise, I keep my spine flexible. But if there's an area of the spine that's fixated, and you've got osteoarthritis starting to form, two bones could stick together. It's called a fixation. And that arthritis that's forming in there will get worse. And that can happen rapidly over a period of 1 or 2 years. So you want to keep these bones aligned, but you want to keep them flexible.
So if someone has arthritis, say, of the spine, what you're basically saying is manipulation will certainly make a difference?
Well, everyone gets arthritis, everyone.
Okay.
Every little traumatic event that happens in our life has an effect on our spine. You could have an injury in your childhood, you could have a car accident maybe in your 20s. All these little things add up, okay? And then as a senior, our spine is basically a manifestation of all these events that have occurred in your life. The arthritis will not be uniform in your spine. In other words, you won't have arthritis evenly throughout your spine, but the areas that were traumatized, like let's say you were whiplashed, 20 years ago, your neck will have more arthritis than the rest of your spine, for example.
Now, is it possible to get arthritis and not have an injury? Is that possible?
Yeah, I think it is possible. A lot of people don't understand that bone forms through pressure, and that's a normal process. Our spine is constantly regenerating, and the bone cells continue to regenerate on a daily basis. But if there's a misalignment of one bone in relation to another bone, there's an increase in pressure in that area. So there's going to be an increase of bone formation, where there's an increase in pressure when there's one bone out of alignment as compared to another bone. So that's where the arthritis forms, and they look like little lips and spurs on x-rays. But yeah, I don't know for sure if you have to have an injury, but a lot of times it does occur with injuries.
Okay, and what do you feel? I mean, how do you feel? Do you feel bad? I mean, is it sore? Is it throbbing?
I think most people feel achy. It starts out as an achiness, and then a lot of people end up not being able to get an entire night's sleep. They'll, instead of sleeping 8 hours like they used to, they'll awaken at 5 hours and they'll think, oh my gosh, I got to get up and walk around. My back feels so achy. And that's those areas where the lips and spurs are. They're putting pressure on not only nerves, but muscle tissue, joint tissue, ligaments, and that's painful. So they get up and move around, and as they move around, get the lips and spurs off of the muscles and ligaments. And the achiness decreases, but it's still there. And that's usually when somebody comes in to our practice and wants help. And we'll do an exam, we'll do a history, and then we'll take x-rays that we can actually see where the arthritis is, and that's where we'll focus. We don't do typical cracking adjustments, like the old-fashioned kind of cracking, on people who have arthritis or spinal degeneration. We have special tables that are designed for people who have arthritis for gentle mobilizing adjustments to the area. And once you have arthritis, you do need to take care of it, just like you would a car. You know, if you need an oil change in your car, you have to take care of your body too. I know a lot of people think, oh, I have to keep going back. Well, you do have a problem in an area, and you do need to take care of it. So, and there are lots of things we do besides the adjustments. We'll tell you certain things to avoid, like sugar. It causes inflammation. So if you're already inflamed from arthritis, you're going to want to avoid sugar as much as you can, because that's just going to increase the inflammation. And then walking on a regular basis 3 to 4 times a week, or swimming, whatever you can tolerate, for 30 to 40 minutes, that's super important too. And then we give a lot of stretches. He has a whole book of stretches that we give to patients depending on the area.
Now, how do you know that it's arthritis? I mean, is this something that you diagnose, or you x-ray, or you feel, or?
When I palpate a patient, they're on the table, basically an area of fixation that doesn't move properly, that's a signal to me that they probably have some osteoarthritis. We take the x-ray, not to see, it's to somewhat guess. I have to say that up front. So that x-ray is very valuable. We have a beautiful x-ray facility.
And we can see the x-rays that day. We take them, and then 2 minutes later they're up on the computer screen in the room, and we can show the patient.
And what a benefit to see the actual area of the spine that's fixated. We can show the patient their x-rays immediately, within literally 10 seconds after they're taken.
So you really have in-house x-rays?
Yes.
Which is great. It keeps a person from going somewhere else to make sure.
Well, a lot of people, they really don't know that they have osteoarthritis, and they're very interested to see their spines and see the areas that are a little bit degenerative, and they need to, it's very important to know what's going on in your body.
Now, if you have arthritis in your feet, is it possible to have a swelling that kind of looks like a bone?
Yeah, you can have extra bone formation that actually does look like a larger bone than normal.
But it's really arthritis?
Yes, there are types of arthritis in the feet that you can actually see that, yes.
Yeah, like Dr. Coursen explained, anytime there's too much pressure on a bone, some kind of abnormal pressure, you'll get extra calcium, and so extra calcific deposition is very common.
Which is very painful.
Yes.
Can be, yes.
Most of the time it is.
What other things, I know that you touched on a few of the things that you can do if you have arthritis, such as the stretching, and of course the walking makes a big difference.
Yes.
Are there any other things that you can do? Not so much as with a chiropractor, but at home, you know,
I touched
in
upon
between.
diet, and that is so important. I have so many patients that come in and they just eat whatever they want, but avoiding the sugar and making fruits and vegetables the main part of their meal. A little bit of meat is important too, and getting rid of the refined processed food that have a whole list of chemicals in them. Pay attention to what you eat, because what you put in your body, it definitely becomes part of you, because our cells are what we put in our body. So you need to take care of yourself.
So you're saying that fatty foods,
If fatty foods aren't good, sugary foods, things that have chemicals in them that you don't know, like if you can't pronounce it on the label, a lot of times try to avoid something like that. Just good old-fashioned fruits and vegetables, nicely cooked with a piece of meat. I think that is the best thing you can do for yourself. I think people will feel a world of difference if they just make that one change to their lifestyle, you know, and also incorporating the exercise. I think that's very important, because we were meant to move. We were not meant to be sedentary. So exercise, stretching, diet, and then occasionally getting a chiropractic adjustment is my recommendation.
very good. What do chiropractors do to help the arthritis sufferers?
You want to touch upon that?
Well, again, it's very important to take that area of the spine and mobilize it. If you don't mobilize it, what happens? You've got a bone here, and the disc in between. That disc is thin. The disc is thinner and thinner and thinner. The bones get too close together. There's nerves in between those bones, and they start to get pressure, more and more pain. So it's very, very important to keep those areas mobilized. And that's, of course,
with these adjustments, you can actually stop arthritis from progressing, because when we go in and adjust the area, you're reducing the pressure. But if you don't do anything about it and that pressure is always going to be there, those lips and spurs grow bigger and bigger. And in the joint, we actually see on x-rays where the bones, actually there are two separate bones with the spurs that have united, and they create one bone. Instead of two separate bones, they're now fused together. That's when you see a person who's no longer able to turn their head. They're going like this to talk to somebody because their bones are fused.
it starts to become too late to do anything about it at that point.
We can at that point recommend massage to alleviate some pain. We do therapies like ultrasound and electrical stim, and we can adjust other areas, but we can't do a whole lot for that particular joint. So it's important to catch it as soon as you're feeling it and come in and have us take some x-rays so we can definitively diagnose it as arthritis.
What about hot or cold? I mean,
Definitely heat. Yeah, moist heat is the best. That's why a lot of arthritis sufferers will take a hot shower to help to loosen their spine and their muscles up. And if you don't want to take a hot shower all day throughout the day, I would recommend investing in a moist hot pack. I think they're much better than just a dry hot pack.
so the packs that you put in the microwave, for example, a lot of them are the neck ones, but then you see the back ones. Those would be good.
Right, yes.
And again, moist heat is better than dry heat.
It helps to penetrate the skin tissue into the muscle.
There is a lot of confusion about that heat versus cold.
Right.
But the general rule is, if it's an acute injury, like it just happened and there's all this swelling, okay, then ice would be the thing to use for a few days.
For just a recent injury.
But for the more chronic, achiness, heat is always better for arthritis. A nice handful of Epsom salts, a hot tub bath, helps draw some of the soreness out. That helps a lot, for example.
Well, it's been enlightening to say the least. Arthritis is something that at some point in time probably most of us will get, whether we want it or not.
That's right.
He's coming in. Is there anything else that maybe we haven't touched on that you would like to just kind of tie it all together for me?
I would mention that a lot of our patients that come in, they do have x-rays that were taken at some other facility. And radiologists typically are looking for fractures or maybe cancer, some kind of carcinoma. If they don't see that, they'll write unremarkable. We take it a step further. We look at those x-rays and we look for that arthritis. We look for the misalignments, the minor misalignments that can become a problem later on. So if a patient has x-rays, we always request those x-rays. Instead of taking more of our own, we'll go ahead and we'll get those x-rays and read those. We'll review them with the patient, take a little time and go over those results with them.
Very good. Well, it has certainly been a pleasure to have both of you here as always. Hopefully, we will see you in the future, but until then, thank you for coming.
Thank you, Joe.
Well, thank you very much for having us, Joe.
Yeah, thank you.